Let's start tonight, though, with Canada's premiers re-upping their call for more money for health care. According to the provinces and territories, they collectively spend $188 billion on health care, and the federal government covers about $42 billion of that, about 22% of total costs. The premiers want a boost of $28 billion. That would mean the feds cover 35% of health care costs. The premiers want that funding increase to happen in the upcoming federal budget. Dominic LeBlanc is the Minister of Intergovernmental Affairs. He's in Moncton. Hi, Minister LeBlanc. Good to have you back on the show. Thanks for making the time.
Good evening, Vashi.
Minister, the premiers presented a very united front today, saying very bluntly that Canadians' health care will suffer without your government increasing transfers to provinces. So let me ask you bluntly, will you do that in the upcoming federal budget?
We've said, Vashi, that we accept the need to increase federal transfers for world-class public health care. It's a value and a policy with which we agree entirely. So we share the Premier's focus on a world-class, accessible public healthcare system. We've also said that this is a period of enormous economic and public health uncertainty. We have transferred tens of billions of dollars to provinces and hundreds of billions of dollars to Canadians just in the last year in terms of supports in the fight against COVID-19. We're prepared to continue to maintain that support. And we're also prepared to talk to the provinces about what an increased federal transfer to provinces and territories for healthcare would look like. But I don't think it's realistic for them to expect that that's going to happen in the next few weeks. And we've been very clear with them on that.
So then when will it happen? And I'm asking you because 3 months ago, we talked about the very same thing. The premiers were asking the same question. You said that there were official level discussions going on. Have those progressed at all? Is there agreement, for example, on one set of facts? Because the impression I think Canadians were left with today is that the premiers don't think there has been any progress.
Yeah, so from our perspective, there has been, in the sense that the federal Deputy Minister of Finance, Mr. Sabia, has been engaged with provinces and territories in terms of, as we said in December, having a basic understanding of the financial state of public health care. The premiers, when they use that 22% figure, very conveniently leave out the fact that the government of Canada, at the request of provinces and territories decades ago, withdrew a certain number of points of personal and corporate income tax, which the provinces then picked up. And that represents obviously billions of dollars of recurring revenue for provinces and territories for healthcare. But when they use that 22% figure, they leave out that amount of money and focus only on the cash portion of the transfer. So we said to them in December, it would be important that we all understand together a basic set of financial metrics. And we're open to having a discussion around how the Canada Health transfer would increase. But at a moment of massive financial and public health uncertainty, Canadians want us to focus on healthcare related to COVID-19, to vaccines, to supporting Canadians. That's what we've done. We've paid 8 out of $10, as we've said over and over again, in terms of all the supports that have been there for Canadians, and we'll continue to do that. But these aren't the exact weeks where the government of Canada should be in a position to make a multi-billion-dollar recurring financial commitment to provinces. There will be a time to do that when the pandemic and the economic recovery is much more clear in terms of the state of the economy, the state of the public health context. And then we'll be happy to have those conversations with provinces.
But their point is that the pandemic has brought to light just how inadequate healthcare for so many Canadians across the country is, and it will only be worse once it ends, right? That's what they're saying. And I find, it'd be hard to find a Canadian who doesn't agree that there are problems with healthcare systems right across the country. Your government has constantly made the argument that high levels of spending, bigger deficits, higher debt loads are okay right now because the cost to service that debt has never been lower thanks to lower long-term interest rates. If you don't want to spend money on something like this, what do you want to spend money on?
Well, I think we absolutely want to spend money on giving Canadians the health care and the public health measures, the vaccines that we all collectively need in the fight against COVID-19. And that's why we've transferred billions of pieces of personal protective equipment, rapid
But they're not
tests,
saying that you're not doing
vaccines to
that.
provinces.
They're saying you've been a great partner during the pandemic, but they're looking ahead to the post-pandemic time, which could be as early as this summer, for example, and saying Canadians will see their healthcare services cut and we need the federal government's help, and you won't supply any timeline for that help.
Let's use this summer as a good example. If the economic recovery is clearer, if COVID-19, and God, we all hope that's the case, is looking like it's in the rearview mirror this summer, that would be the time where the government of Canada would be in a position to say to them, this is the amount of money that we're prepared to spend on an ongoing, recurring basis in an unconditional way for healthcare, for public healthcare in the provinces. The premiers are correctly saying that they need money urgently now in the COVID-19 context. That's exactly what we've done, I think, very effectively with the provinces. And what we're saying is we need to have a better understanding of the state of the federal finances, of the state of the Canadian economy, and the state of the healthcare system. And until then, we're prepared to pay massive amounts of money to support a healthcare system. And when that moment arrives, if they think it's this summer, that's terrific. We'd be very happy then to sit down with them and look at the right amount of ongoing financial increase that we would make with respect to provinces.
And just very quickly, Minister, when you said unconditional, that means when you do agree to some sort of formula for an increase, there will be no strings attached to that money.
Well, that's the context now, Vashi, of the Canada Health Transfer. Yeah. But a lot of Canadians are saying to us that in the past, when the government transferred money to provinces, increased money, if it was Mr. Martin's government, if it was Mr. Chrétien's government, increased transfers to provinces for healthcare, some people are saying to us they're not seeing the results they expect. That's why, for example, some years ago, we transferred billions of additional dollars to provinces and territories, specifically focused on mental health and on home care. And we think that's also a successful way to support increased transfers. So we're prepared to have those conversations, but we don't think now, and Canadians, when they're focused on fighting COVID-19, on vaccines, on public health care measures, Canadians expect that to be the primary focus, not a multi-billion-dollar perpetual transfer at a time when there's such great uncertainty.
So just respectfully, though, I didn't really understand. Are you saying then that the increase in healthcare money, when it does come eventually, could be through the CHT and therefore without strings, or could come with strings through another means?
We're prepared to discuss both, Vashi, once the public health and economic context is more certain. The premiers have asked for an increase in the Canada Health Transfer. That's unconditional money. We've said we're prepared to increase the Canada Health Transfer. So some of the increase would obviously be in an unconditional context in the Canada Health Transfer at the right moment. But we're also, for example, now talking to provinces about a way we could work together on the high cost of drugs for rare diseases, on improving outcomes in long-term care, on what we can do around a national pharmacare strategy. So we are also having at the same time active conversations about increased transfers to provinces for things as important to Canadians as better long-term care for elderly persons who are residing in these facilities.
Okay, Minister, I'll leave it there. Thank you very much for your time as always.
Thank you, Vashi. Have a great evening.
You too. Canada's premiers are once again calling on the federal government to up its funding for healthcare, and they want to see a permanent increase to what's known as the Canada Health Transfer. That's the money the feds send provinces for healthcare in the upcoming federal budget. We just heard from Intergovernmental Affairs Minister Dominic LeBlanc, who says it's too soon to make that commitment. Scott Moe is the Premier of Saskatchewan. He joins us from Regina. Hi, Premier Moe. Good to see you. Thank you very much for making the time tonight.
Well, thank you, Vashi.
Premier, on the request that you and your counterparts are making, the federal government during this pandemic, it's hard to say that they haven't contributed where healthcare dollars are concerned. They've increased funding by $52 billion. The point the Prime Minister has made since this was first articulated, this request was articulated in December, was let's wait till the pandemic's done, then we'll talk about increasing the CHT. I just spoke with Minister LeBlanc. He said that, for example, if the pandemic were at that point in the summer, then he will come together with the premiers. They will come together on a specific amount to increase the CHT by. Isn't that reasonable?
Yeah, sure. But a better time for the federal government to engage on this would be to commit to a 35% funding, increasing the CHD on behalf of all Canadians, become a full funding partner during the budget here this spring, the budget that we've waited far too long for in this nation. So they have an opportunity in the budget to come forward with committing to being that full, fair funding partner in healthcare, in core healthcare services right across this nation on behalf of all Canadians. They have that opportunity in the budget, and I think it's fair to ask the federal government to consider that.
Why the budget? And I'll ask you again, because I did pose the question to Minister LeBlanc flat out, are you prepared to do that in this budget? The answer I got was, and I'm paraphrasing, but essentially no, that they are really keen to wait until they know the full picture of spending on the pandemic. If you were in their shoes, isn't that the fiscally responsible thing to do?
This is not about the pandemic. This is about core healthcare services that provinces and territories continue to provide. This is an ask at various amounts that has been there for decades. In fact, back in 2003, the formation of the Council of Federation table was very much in part due to the lack of participation at that point in time by the federal government in the Canada Health Transfer. So it's been a long-standing ask for the federal government to increase its funding to become that full funding partner in providing healthcare to provinces. And we feel the federal government should move forward in their spending plans, in their annual spending plans, in increasing this at the budget time, which is when the plan is mapped out for the course of not only the next year, but then it would be incorporated into the following years as well.
But the plan can be adjusted. I mean, isn't it fair to say, if you were crafting your own budget, for example, that there's a lot of uncertainty throughout the pandemic, that the majority of your spending is going to have to be focused on responding to that pandemic. And once things are in the clear, so to speak, then you can start thinking about long-term, more sustainable funding for a lot of different areas. I have a hard time believing you would take a different approach.
And most certainly, what our ask is for the federal government to include this in the budget. That would show a firm commitment to being that funding partner. It would show a firm commitment to investing in the provincial and territorial healthcare systems that are being delivered to Canadians from coast to coast to coast. And, for example, we're going to have some very immediate needs here in Saskatchewan with respect to our surgical wait times that we had invested in greatly in prior to the pandemic in reducing those wait times, but they have slipped up. We have 19,000 surgeries that were not performed during COVID relative to the year before due to COVID. And we most certainly now, our wait time has increased, and we're going to have to invest literally tens of millions of dollars in this province, just simply in our surgical wait times. Never mind future investments in long-term care, never mind the increasing need in our communities and communities right across the nation in mental health, and all too often the subsequent addiction challenges that come from that. We are asking the federal government to put their foot forward in this budget and become that full funding partner that has been requested of not only this government, but subsequent governments for decades now.
But on the point of how much they agreed to and when, I mean, you're a conservative premier. Many of your counterparts are conservative as well. You stress about the size of the deficit. You talk about the importance of balanced budgets. We're talking about adding tens of billions of dollars to an already the biggest federal deficit since World War II. It's a big decision to make. And I understand the point you're making about healthcare. I think many Canadians are empathetic towards the need for it right across the country. But adding that much to the deficit in the middle of the pandemic, while you're already adding pandemic spending to it, I still fail to see how it doesn't make sense to wait a few more months to come to that agreement.
It is a large amount, but it is about priorities, and it's about the priority of the federal government and where they place the health and welfare of Canadians. We have a traditional, what started out as a 50-50 partnership between the federal government and the provinces, a cost-shared agreement to provide health care to all Canadians. Now, that has evolved over the years in the services that have been provided, as well as the cost-share agreement has evolved to a level of where we're just over 20% is now coming from the federal government. So we need to sit down and have some very serious conversations about rebalancing this. We're not asking to go back to a half and half. We're asking the federal government to come up to a 35% share. It is a lot of money. We understand it is a lot of money, but it also is about priorities of the federal government and the priority that they place in the health and providing health care to all Canadians.
Are you and other premiers willing to increase spending of your own on healthcare by the same proportion? And I'll put this challenge to you from the parliamentary budget officer who studied the CHT back in September of 2020, or sorry, September of last year. He said from 2012 to 2016, provincial territorial governments limited CHT targeted health spending growth to 2.9% annually on average, just under half of the growth rate of CHT transfers. So when federal money goes up, it appears in the past, provincial money goes down. Are you and your counterparts prepared to commit to increasing money at the same degree you're expecting the federal government to?
We already have. The provinces have already increased their proportion. They're investing 78% of every healthcare dollar across the nation. So the provinces are already there. It's the federal government that needs to increase their support of providing healthcare to Canadians right across this nation. The provinces are there. We're asking the federal government to ultimately catch up. And as we go forward, there's a number of reports that indicate that the healthcare spending is going to continue to rise at, in the neighborhood of about 5% each and every year annually. We've been trying to keep up with that level of increase at the provincial level. So us in Saskatchewan, our healthcare budget is far beyond 40% of our annual budget, and we have tried to be very prudent but very effective with the dollars that we put in healthcare. So the provinces have already made the investment. Now it's the federal government's turn.
But the parliamentary budget watchdog has a different assessment, right? Says that actually when the feds were committing more, the provinces decreased the portion that they were putting forward. Are you committing to the idea that you as premier would never decrease the portion that you're putting forward if the feds do pony up more?
As we move forward, we're all going to be investing more in healthcare as far as the dollar amounts go. The annual increase in escalators are there. They've been there for a number of years already. I would say that the provinces have been picking up the excess for the last number of decades. This has been an ongoing ask and an ongoing sore point, really, between the provinces and the federal government in the lack of having a full federal partner in funding healthcare that is delivered by the provinces. So, as I say, the provinces have already made that investment, and they continue to make that investment in light of the federal government not stepping into their space.
Respectfully, though, my question was if the federal government does step into that space to the degree that you want, will you guarantee people in Saskatchewan that your portion of that, of funding healthcare won't decrease as a result?
Yeah, and my point in the years ahead is both the province and the federal government are going to be investing more in healthcare. Healthcare costs are not decreasing. They're going up by what looks like about 5% a year. They're up a substantial amount this year, both with, yes, some federal dollars, some one-time federal dollars that have been invested.
A lot of federal.
But also provincial dollars, a significant amount of provincial dollars that have been invested in just testing, contact tracing, and keeping our health system running with very low outcomes on the surgical side, like I had indicated. I don't know how many tens of millions of dollars it's going to take over the next 3 to 5 years for us to catch up on our surgical wait list, but we're going to have to make those investments. We're all going to be investing more in healthcare in the years ahead, both the province and the federal government.
Okay, Premier, I'll leave it there. Appreciate your time as always. Thank you.
Thank you.